My name is Hattie Giblin, Physical Therapy LEND trainee. My year in the South Dakota LEND program taught me that disability care is not one size fits all. The biggest takeaway I'll carry forward is to listen first, understanding someone's lived experience before planning their care. I'll use that in my future practice as a physical therapist by being more intentional, collaborative, and family centered. To the future LEND trainees, fully engage, ask questions, and step outside your discipline. That's where the growth really happens. For me, LEND has meant teamwork. Working in an interdisciplinary setting showed me that collaboration is key to patient-centered care, and I valued learning what each discipline contributes to that team.
Hi, my name is Taya Wiedemann and I'm an occupational therapy LEND trainee. My experience with LEND has been incredibly impactful and significantly influenced my growth as both a person and as a young healthcare professional. Throughout the program, I strengthened my interdisciplinary collaboration skills and learned from families, self-advocates, and other professionals across a variety of settings. One of my biggest takeaways is the importance of providing interdisciplinary, family-centered, and compassionate care while truly listening to and valuing the experiences of those that we serve. Overall, LEND has strengthened my confidence, expanded my perspective, and reinforced the type of healthcare professional I hope to become.
Hi, I'm Danny Richardson. I'm the clinical psychology LEND trainee of this year. LEND has been a wild ride from start to finish, but one lesson that it has taught me that I will continue to use is to never be afraid to speak up and advocate for your client, even if you don't feel like you're the most professional or experienced in the room. To the upcoming LEND class, one of the most important things that I remember being told is to engage in every experience you can, really embrace that moment and immerse yourself in what's going on. Overall, LEND has shown me what multiple disciplines can do in a short amount of time to help change an individual and the family's lives. LEND has strengthened my professional network, given me invaluable resources for my future practice, and has really given me an odd but functional family.
My name is Jordan and I'm a third-year school psychology student and LEND trainee. One of the most memorable parts of my LEND traineeship was working in the developmental clinics as part of an interdisciplinary team. It felt very meaningful to address families' needs in a holistic and well-rounded way. My real-life family experience also had a strong impact on me as it gave me a deeper understanding of the experiences families navigate day to day. I will forever be grateful for everything that LEND taught me this year.
My name is Caitlin Tegedoff, and I'm a speech-language pathology LEND trainee. As a LEND trainee, I was hoping to learn more about the collaborative experience of a multidisciplinary team. This year has exceeded my expectations as I did not only learn about how to work with other disciplines, but I learned how to focus this approach on patient care. LEND taught me how to listen to each concern and family with intention, empathy, and an open mind. Then to approach each case by working with every member of the team and to create an individualized treatment. Going forward, I will utilize many skills that I learned in LEND, but this was by far the most important.
My name is Alex Allison, and I was a fourth-year audiology extern and LEND trainee. Coming into LEND, I was hoping to learn more about healthcare professions in regard to when we refer to them, but LEND taught me the impact we can have when we work as a team to provide comprehensive and patient-centered care. My advice to future LEND trainees is to truly take advantage of every opportunity in front of you to observe clinics, complete trainings, attend trips, and ask as many questions as you can, because you have the opportunity to learn so much, not only from the professionals and future professionals around you, but also from yourself. Truly, what you put into your LEND experience is what you'll get out of it, and I can say I'm a more well-rounded and confident clinician and person because of my LEND experience.
Hi, my name is Parker Owen, medicine discipline trainee. My initial pull towards joining LEND was the interdisciplinary aspect of the program. I wanted to learn more, especially as someone who's going to be a physician one day, about not just how to lead interdisciplinary programs, but how to be a part of it and how to be an effective listener. I can confidently say that after going through this, I have gained more than just that knowledge. Seeing how these teams interplay, seeing how experts go back and forth, and also knowing when to step back and when to step forward in these team dynamics has been a great benefit, and I'm excited to be able to use it throughout my career.
I'm Hannah. I was a 2025-2026 physical therapy LEND trainee. One of the most memorable moments for me was during my developmental clinic when the child chose me as her safe person. She would not continue unless I was right there next to her, hand in hand. And in that moment, I realized it wasn't about doing everything perfectly. It was about being someone that she felt safe with. That experience alone reminded me why I chose this field, to help people feel seen, supported, and absolutely never alone. So why lend? Because moments like this stay with you and they shape you to the kind of provider that you will become in the future.
Hi, my name is Haley. I was the nutrition and dietetics trainee for the 2025-2026 year. My experience in the SD LEN program has been really meaningful. Through leadership development, clinical experience, and research, I've grown a lot in my confidence, self-awareness, and understanding of interdisciplinary, family-centered care. This program has really strengthened my professional identity and reinforced my passion for supporting children with neurodevelopmental disabilities and their families. As I move forward in my career, I feel excited and prepared to keep building on these experiences and continuing to grow as a collaborative, thoughtful healthcare professional.
It's taking our self-advocacy. What I took most out of Len is boosting my more self-confidence and being a self-advocate for myself and my other peers as well. And a lot of things will stick with me throughout Len. I'll still be a part of it because I'm pretty sure another person in all EXs will be the new self-advocacy trainee. So I'll help her with that. I was hoping to gain more and more experience with my self-confidence, more leadership skills, and I got that. Especially since now I'm an ambassador for S for a Charting in Life course. What I'll tell future trainees not to be afraid to take a chance and take a risk to do this, even if you don't want to do it because you don't know a bunch of people. I did it and I loved it so much. I met great new friends and and you will have so much fun in this, especially when you go to Pier. My Pier was a fun trip with all this cohort. Len has meant to me as growing my confidence, my leadership skills, and throughout my life, I will take this with me and keep doing leadership skills and building my self-confidence as a self-advocacy for other people with disabilities like me. Thank you.
Hello, my name is Elizabeth Allen, and I'm an audiology student with the 2025-2026 LEND cohort. And overall, LEND has helped me grow so much, both personally and professionally. I've learned so much about teamwork and advocacy and leadership and the importance of listening to individuals with disabilities and their families. I would tell future LEND trainees to really take advantage of every opportunity, even the ones that feel outside of your comfort zone, because those are usually the experiences that end up teaching you the most and staying with you long after the program is over. One of the most memorable parts of my LEND experience was the legacy trip, where I volunteered at Give Kids the World with Make-A-Wish families. What really stuck out to me was getting to know the children and families without first knowing their diagnosis or medical histories. It reminded me how important it is to see people for who they are first, not just through a clinical perspective. And that experience completely changed the way I want to approach patient care in the future as an audiologist.
Hi, my name is Paige Melberg and I'm a nutrition and dietetics trainee. So it's hard to narrow down just one meaningful part of LEN because this experience has shaped me in so many ways. I've grown in my confidence interpreting research, participating in interdisciplinary clinics, and developing leadership skills. But the biggest lesson I'll carry with me is the importance of truly getting to know people, like your classmates, faculty, patients, and families. LEN reminded me to look beyond the medical diagnosis and see the whole person. Those connections not only make us better providers and advocates, but they also open doors and opportunities that you would never expect. LEN reminded me that learning and advocating never really stops, and that's what makes our work so meaningful.
Hi everyone, my name is Cole Knoblich and I'm a 2025-2026 South Dakota LEND medicine trainee. I think one of the most memorable experiences for me was going to be the LEND developmental clinics and just getting to work as a team and kind of seeing the different specialties for the first time and kind of seeing what they can provide to the patient and how they can best assess the needs of a patient. As someone with brothers with autism, I also really enjoyed meeting with my LEND real life family and kind of just connecting on a more personal level. And then lastly, any advice I would give is to really attend as many clinics as possible. There are going to be opportunities you might not get in your education, and you never know what you're going to learn and how it's going to benefit you for yourself and your future patients and your careers.
My name is Kyla Price Wallen, and I am a school psychology LEND trainee. Throughout the many experiences I've had during my LEND traineeship, I feel my perspectives on collaboration, students with disabilities, leadership, and advocacy have been shaped in a way I could never have imagined. I'm grateful to have an expanded understanding of the roles of team members that may support students and their families. Because of LEND, I feel more equipped to look at future clients in a person-centered manner, making their needs and preferences a priority.
I'm Haley Sterud. I was the social work trainee this year. LEND taught me a lot about what other disciplines do and how to work with them and make sure that we're all collaborating to fulfill the needs of the child or family we're working with. I had the opportunity to work both in LEND and with another agency that serves individuals with disabilities. So it was really cool to see the different approaches that different agencies take and how we can all work together to serve this population.
My name is Amanda Ewalt. I am the parent trainee. Why LEND? We have realized the value of LEND as we have discovered many of our most beloved providers are actually graduates of the South Dakota LEND program. What have I learned? I have gained a better understanding of the disciplines and what their role is within a care team. And that has given me the skills to be a better advocate for my children.
Hi, my name is Maddie Melanson, and I'm a medicine trainee. Through the LEM program, I've come to learn so much more about different areas of healthcare and come to really appreciate how by working together, we can help to get the best outcome for our patients. My favorite memory was definitely the peer trip and getting to learn more about legislation. And I would tell any incoming trainees that this is one of the best chances you'll have in your career to ask questions to your classmates and learn more about what they do and how you can work together.
If I could say anything to the future LEND trainees, it would be that you get so much more out of LEND than what's on paper. You get to serve in a multidisciplinary team, working with other professions, and you get to serve as the expert in your field, which is super rewarding and such a confidence boost during your training. Additionally, I've made such incredible professional connections, but I've also made some really awesome friendships through LEND that I know I'll carry with me throughout my life. I'm so excited to see what I accomplish with all the knowledge that LEND has taught me, and knowing that I have such an incredible network of like-minded professionals that I can turn to in my future career when I need help. So really, LEND has just been such an incredible experience, and it's really one of the best things that I've done in my graduate studies.
Hi, my name is Jordan Hermanson. I'm a second-year Doctor of Occupational Therapy student. Some of my favorite experiences from LEND were connecting with my real-life family, as well as getting to go to the specialty clinics. I'm very grateful for the opportunity of going to Washington, D.C. for the Disability Policy Seminar. And what I will take from this experience is all the leadership development I've gained, as well as knowledge from the specialty experiences.
I am Paige Crum, a 2025-2026 occupational therapist, LEND and PACE trainee. Through this experience, I have learned the importance of interdisciplinary care and how essential it is for interdisciplinary teams to focus on family-centered care. This experience has taught me the importance of early intervention, and I hope to carry these experiences with me and into my future practice.
My biggest takeaway from LEND is learning how to grow and really embrace the unfamiliarity in order to learn from it to not only benefit myself, but my future patients that I have. An example was the legislative trip. This put me in a completely unfamiliar situation. I was able to grow and get outside my comfort zone by learning about something completely new. Also, getting to be a part of a pre-clinic team helped me to shape my leadership skills and my communication skills. Through all the LEND experiences, I learned to become more intentional in how I communicate and collaborate with both patients and interdisciplinary teams. This has truly shaped how I will show up as a future clinician.
Hello, my name is Kayla Sentis, and I was a 2025 to 2026 LEND trainee. Prior to my LEND experience, I was hoping to gain more knowledge over not only my discipline, but other disciplines as well, and how we can work collaboratively to provide the best care for our patients and clients. LEND definitely exceeded all expectations. One of my mottos in life is that there's no growth in the comfort zone, and LEND definitely takes you out of your comfort zone, but in the best way possible. I learned more about who I am as a leader and as a future clinician, and these are things that I will take with me as I begin to practice and treat patients and clients. Thank you so much for this experience, and I'm excited to see where LEND takes other trainees.
My name is Summer, and I'm a speech language pathology student. And one thing I would tell future LEND trainees is to take every opportunity you can and engage in every event you can, because there are so many amazing opportunities through LEND that you can learn from and engage with other individuals, especially individuals with disabilities, and you learn so much from these events and clinics.
Hello, my name is Abby, and I'm a 2025-2026 Occupational Therapy LEND and PACE trainee. Being a part of LEND this year has given me opportunities to collaborate with an amazing and interprofessional team and observe a variety of clinics. My most memorable experience this year was during the first LEND developmental clinic, where I was able to actually enter the room and help administer an assessment with my peers. What stood out to me even more was the care team conference with the child's mother after. Seeing the team communicate with a gentle and strengths-based approach was truly inspiring and taught me the power of a provider's words. Through LEND, I've gained a deeper understanding of the roles of other professions, and it has been exciting to watch my classmates grow more confident in their professional abilities. I'm so grateful for everyone who dedicated their time or shared their families with us this year.
During my time in LEND, I gained a deeper understanding of the importance of interdisciplinary collaboration, as well as the importance of family-centered care when working with people with developmental disabilities. I will use this knowledge in my future career as an audiologist.
Hello, my name is Samantha Score, and I was a second-year occupational therapy student in the LEND year of 2025 to 2026, and my most memorable moment was spending time with my LEND family. They just gave me such great insight to how to support them as a person, as a friend, and as a future clinician. Along with this, LEND has impacted me not only developing myself, as well as how I can better attend and cater services to my future clients.
Hello, my name is Caitlin Kitka, and I am an occupational therapy LEND PACE trainee. My biggest takeaway from the LEND program has been improving my understanding of the role that different interdisciplinary team members provide to a plan of care for a family with a child with a disability. I've also understood how to professionally collaborate and communicate with them, and how to provide appropriate referrals to families depending on what they're presenting with. Before the LEND clinic and LEND experience, I would not have known the full scope of practice and clinical expertise that each interdisciplinary team member brings to a child and family's plan of care. And after all of my experiences, I plan to use the knowledge that I've learned in LEND to advocate for other professional services by providing referrals to families so that they can receive the help that they need to feel more understood and thrive in their environment. I'm very grateful for everything that the LEND program has provided me, because I feel like I've grown a lot as a student and also as a future professional. So thank you for everything.